3 fellows in the Department of Pathology and Center for Cardiovascular Diseases and Sciences have been awarded postdoctoral fellowship grants from the American Heart Association. These grants support ongoing cardiovascular research by funding the fellows' salaries, professional travel, and lab materials for the next 2 years. Dr. Chaudhry Abdullah in Dr. Bhuyan's lab is studying the mechanisms of diabetic cardiomyopathy and how specific receptors may be used to protect the heart in patients with diabetes.
Diabetes affects more than 30 million Americans according to the latest report. Diabetic patients have increased heart failure, but unfortunately there is no therapies to protect the heart in diabetic patients. We aim to study a unique protein named sigma-1 receptor with the aim that will prove that sigma-1 receptor is protective in heart. Thus our findings in future will accelerate the drug development targeting sigma-1 receptor to protect the heart in diabetes.
Dr. Matthew Scott in Dr. Orr's lab is studying a specific protein's role in plaque buildup and how it might be used in cardiovascular disease medicine in the future.
My research is focused on one specific cell type within the plaque, the smooth muscle cell. And so if you think of a endothelium, the blood vessel, you have the endothelium, which is the inside cell that makes the vessel itself, and then smooth muscle cells surround the endothelium and help regulate the tonicity of the vessel as well as its diameter. What we are looking at in these cells is a particular protein, the human F receptor protein. We think it can exacerbate disease formation in certain cell types, but can also be used to promote the formation of what can be considered a stable plaque. What we're hoping is that we can not only prevent the formation of these late-stage plaques, we can promote plaque stability and keep people from hopefully having to get stents and things of that sort that can allow them to continue to live even with these diseases because the plaques are safe, they're not going to rupture.
Dr. Mabruka Al-Fayadi in Dr. Orr's lab is studying the role a specific protein plays in endothelial cell function and how it might be targeted to prevent heart attacks.
So my research is mainly to characterize how the lipid is accumulated within the lumen of the artery. And we work on the endothelium, which is single monolayer of cell lining the physical wall, and we try to characterize if we can target this layer to make it healthy so we can resist the lipid accumulation into the physical wall. By providing funding from AHA, this will give us the resources and the time so we can generate a small molecule inhibitor. So this inhibitor will go into the blood. We hope we can inject patient with this molecule or give it as oral therapy, and it will go into the bloodstream and taken up by the endothelium. So inside the cells, it can prevent the lipid accumulation. So it's kind of increase the endothelial cell defense against the lipid in the physical wall. So we were hoping if we can give this drug to patient and slow down the process of heart attack or even prevent the disease